Do diabetics fast? Hi guys. Welcome my video. Please subscribe to our channel. News and health for more latest update video. I hope you are all well. In today's video tutorial I will share a great news with you. I think you all will finally watch my video with a little mind. It is normal for every Muslim to fast. There are many of them who are suffering from diabetes. On the one hand, they want to fast, on the other hand, they are in a dilemma as to whether or not to fast with diabetes. Many people do not fast out of fear, many people want to fast again by changing their medicine. Many doctors also suffer from confusion in this regard. But the unimaginable advancement of modern medical science has made it much easier for diabetic patients to fast. If you have diabetes, you can't fast, that's not true at all. Both specialist doctors and Islamic scholars are in favor of fasting. Therefore, diabetic patients who are aware of the risks and are determined to fast for religious reasons can avoid complications by consulting a doctor before the start of the fast. Diabetes can have many complications. Since a fasting person does not have to eat for a long time from sunrise to sunset, they are more likely to have complications. Complications that diabetic patients may experience during fasting include low blood sugar, hypoglycemia, high blood sugar, hyperglycemia, dehydration, and diabetic ketoacidosis. In addition, many people fast during this month and overeat the rest of the time and do not exercise or walk around, resulting in increased blood fats and body weight, and diabetes is often out of control. Prolonged abstinence from food can lower blood sugar, called hypoglycemia. This risk is especially high for those who take sulfonylureas, insulin, do not eat sayuri or eat too little or overwork. Hypoglycemia is characterized by palpitations, excessive sweating, dizziness, body tremors, blurred vision, etc. The patient may become unconscious. In this case, if possible, the amount of blood sugar should be checked immediately. If the amount of sugar is 3 or below, the fast should be broken. Immediately take glucose or sugar syrup or any food. Blood sugar can sometimes be excessively elevated, called hyperglycemia. Symptoms include dry tongue, dizziness, dehydration, weakness, drowsiness, vomiting, etc. In this case, blood sugar should be tested immediately, and if the amount is high, insulin should be taken according to the doctor's advice. Many Islamic thinkers are of the opinion that fasting will not be broken if insulin is injected while fasting. The way to get rid of dehydration in the body is to drink more water at night. Even after that, if the amount of dehydration is more while fasting, such as excessive dryness of the tongue, more dizziness, if there are any signs of excessive urination, action should be taken as per the advice of the doctor. If necessary, the fast must be broken. This risk is higher for those who work harder or work out in the heat. This water vacuum may be more pronounced due to excessively hot and humid weather. For those who only control their blood sugar through diet control and regular exercise, fasting is a golden opportunity. Fasting does not cause any complications for them, but helps in controlling the disease. The practice of abstaining from food during the day in fasting and eating in moderation during iftar and sayuri teaches any diabetic patient moderation and discipline, which is a key ingredient in the treatment of diabetes. Through this, the patient can control the amount of his blood sugar and fat, can lose excess weight. Many take extra food during Ramadan, while others eat very little. Remember, both are harmful for a diabetic patient. In this case, the following tips can be followed. Sayuri food eaten at the end of sayuri. Don't eat too much fatty or sweet food during iftar. Eat small amount of fried food. Adequate intake of water and other fluids. Maintain calories in food and eat nutritious food. Overeating in iftar and avoiding small meals in sayuri. In some cases, oral medication is needed to control diabetes. Of these, those who take metformin, glitazone or incretin have a much lower risk of hypoglycemia. However, sulfonylurea drugs or insulin can cause hypoglycemia by excessively lowering blood sugar levels. Therefore, patients taking these medicines should take proper preparation before Ramadan with the advice of a doctor. Fasting may require some changes in the diabetic patient's medication. The changes that are usually made are that those who take the medicine 3 times will eat more during iftar and less during sayuri. If you have to eat twice a day, eat the morning dose at the beginning of iftar and the night dose at half the time of sayuri. Those who take insulin can use long-term insulin in fasting, which makes the chances of hypoglycemia relatively low. This insulin should be taken during iftar and in small doses on the last night if necessary. Patients taking insulin must adjust the type and dose of insulin before Ramadan. According to expert Islamic thinkers and scholars, blood tests can be done during the day while fasting, and even insulin injections can be taken if necessary. This will not invalidate the fast. To avoid possible complications, diabetic patients should have their blood sugar checked 2 hours after Sahari and 1 hour before iftar. In addition, you should refrain from working hard or exercising during the day. Exercise can be done 1 hour after iftar or dinner. Please share this video if the news is important. If you like this video, please subscribe to today's video. Thanks everyone.